Carry on. So today we're going to look at active birth and yoga. So looking at how yoga can be beneficial for a woman who is going through labor and then birth. So first, looking at yoga. Yoga is going to help prepare her physically, mentally, and spiritually for birth. And it can be beneficial regardless of the type of birth that she's going to be having, whether it's going to be a natural birth, whether that natural birth is going to be at home, whether it's going to be in the hospital or a birthing center, or even if it's going to be a cesarean, whether it's a planned cesarean or an emergency cesarean, yoga is going to be beneficial. What kind of things she is practicing, of course, it will change accordingly. But what is most important is relaxation, and relaxation is necessary for mother and in turn for baby. And the more relaxed she is, the less chance there's going to be interventions, and the more peaceful the environment and happier the baby in its first moments of life. And of course, the happier the mother too, when she's just birthed her baby. So yoga is really, really beneficial for whatever kind of birth she is going to be having, whether a planned birth or unplanned birth. And as we know, birth is unpredictable, but yoga will be very, very. So yes, birth is unpredictable. We never know exactly how it's going to be. We don't know how long it's going to take. We don't know when it's going to be starting. We don't know how she's going to be giving birth. We don't know if there's going to be any kind of interventions. We don't know. Unless it's a planned cesarean section, which is also why some women choose to have a planned cesarean, because they want everything controlled. But basically for normal birth, you can't control it. And it's important that we understand that it's a natural process and we shouldn't be trying to change things around. Baby comes when baby's ready and mama's body is ready. And of course, the birth, like I said, it can be very variable. Even if she's given birth before, it doesn't mean that the second birth is going to be similar to the first one. They can be very, very different. So whatever birth it is, however long it is, whatever has to happen for her to birth her baby, it's important that there is acceptance. And that's where, we can have a birth plan, we can have all these ideas, what we want to there to be in a birth, how we want things to be, but it doesn't always turn out that way. Of course, having a birth plan will help a lot for oneself and also for those around, the support, but still we need to accept however the birth turns out. And it is actually a really important point because many women can feel upset if they didn't have the perfect birth. Or what they think is the perfect birth. So it's important to see the positives of however the birth turned out. And remember, it's not only about birth, but definitely there are a lot of things that we can do to help us understand birth more, to understand the process of birth, to understand our options as well, because education is really necessary about the process of birth and how we can help ourselves as well. Like just knowing that, if I get off the bed and I move around, it's going to help. Is such a big thing that many women don't really know about because they look at the movies, they see a woman laying on the bed, screaming, and they see, a ton of doctors all around with her legs up in stirrups, and that's how you give birth. So the idea of what's normal in birth is very different for different people. So that's where it's really important to have education and to hear about positive birth stories especially, and know that, okay, this doctor says this thing, it doesn't mean it has to be right. There's always other opinions, and it is important that we talk to different doctors or midwives or whoever is going to be the support, and that they also understand what we're hoping to get from the birth. So that's something to be remembering. Then next is about drugs or any kind of pain killers. And I hadn't talked about this in the first lecture, but of course, some women will find that the sensations can be too strong for them, and so they decide that they're going to use some kind of medications to help remove that pain or to decrease it. So there's lots of different options, and in different countries certain things are used more than others. In some countries the epidural is very, very common, so that's the injection into the spine, which is going to anesthetize the lower half of the body. There's different levels of that, of course. If she is having an epidural, of course, that means that she can't get off the bed. She can't be moving around in that way. There's always pros and cons to all of these things. With the epidural, okay, it can help if the pain is too intense, she's not able to deal with it, but it means she can't move off the bed, and it also can create problems later on in life. Like many women who have had an epidural, they do find that they have lower back pain, chronic lower back pain. It also means that when she is giving birth, there's only certain positions that she'll be able to give birth in, and it also can slow down the labor for many women. The contractions can decrease. So prolonged labor can also lead to her having to have a cesarean in the end when they think that it's just going on for too long. And also, of course, having an epidural is going to be affecting the baby too. So the baby can be quite drowsy at the time of the birth. And of course, there's other kind of things like a laughing gas can be used. Other types of painkillers can be used. Of course, these are also going to be affecting the baby to some degree. So one does always want to aim as much as possible to go down the natural route. So, using yoga techniques to help deal with pain. And we'll talk more about management of pain later on. But of course, it is important that if she tried things and it really wasn't for her, or she didn't feel comfortable and it was getting too much, and especially if she had a lot of fear, then it's important that she doesn't feel guilty and she doesn't feel disappointed if she did need to have some kind of drugs, or if she had some kind of complication. So, for example, if she was wanting to have the natural birth and it ended up having a cesarean, sometimes she does have to have a cesarean. I mean, the rate of cesarean is very, very high all over the world at the moment, and it's absolutely not necessary. The World Health Organization says there shouldn't be more than 10% of women giving birth by cesarean section, but in some countries you see it's even higher than 90%, which is really, really crazy. And in many countries it's very normal for it to be 40 or 50%. And of course, with cesarean, there are other negative effects both on the mother and on the baby. So it's always better, if possible, to go for a natural birth. But yes, sometimes factors can come up, like sometimes, if baby was stuck or suddenly baby was getting very stressed and one needed to take baby out fast. Those are some reasons why there can be a cesarean. But basically it's said that really only about 3% of women actually need to have a cesarean, which is a tiny percentage compared to what's actually happening out there. So that's just something to think about. Other complications, of course, can be things like if she needed to have vacuum or forceps for the delivery. So sometimes she can be feeling very guilty or disappointed about that. So it's really important that she just accepts whatever has had to happen and be grateful and happy that she's nurtured her baby for 9 months, and of course will continue to do so for the rest of her life. So looking at the traditional ways of giving birth, so you can see here that everything is upright, and pretty much in every country all over the world, women have always given birth in an upright position, whether it's standing, whether it's squatting, whether it's using something as a support, but not laying down on the back. So here you can see this lovely position laying on the back. So this is what we normally think of when we think of giving birth. You know, she's laying there with her legs up, and this is known as the lithotomy position. And this is a position which is the easiest for doctors because they can see everything. If you're in a standing position, it's hard for them to see, you know. So this is what has always been preferred. Well, in the last 100 years or so, when birth became something as a medical procedure instead of like a normal natural part of life. So this position suited the doctors very well. Of course, it doesn't suit a woman who's in labor because it's the most uncomfortable position, most painful position she can possibly be in. So there was a woman known as Janet Velasquez. She started the active birth movement and she wrote books after that. She's written a few books on yoga as well. So she was fed up with the way that women were going through labor, and she said, we need to start moving. We need to get up. We need to try different positions so that she's going to be more comfortable, so she can deal with pain, and to be able to birth her baby in a more effective manner. Because all the knowledge used to be there. Women knew how to do it. They knew all different types of positions. But then once it became medicalized, all this knowledge was kind of thrown out. So she started kind of that movement of bringing it back in and encouraging women to move, and that has helped so many people since. So we'll talk more about. So looking at how different types of poses can be helpful. So some of these can be yoga poses, and some of these are just different positions of the body that are really helpful at the time of labor or birth. So if we're leaning forward or if we're squatting, we're opening up the pelvis, the pelvic canal. So the lower part of the sacrum tilts backwards. Okay, so this opens up a lot, and this is very helpful for baby to move further downwards. Squatting particularly increases the space between 25 to 30%, which is amazing that you can open up the pelvis that much. So compare laying down on the back in lots of pain or squatting position where everything opens. And I still remember when I was in labor, when I was in a squatting position, when I moved to squatting, immediately my baby started moving down, and I was like, right, this is the position I need to be in. All the other poses, yes, you know, he was moving slowly, but that one I knew was the one that really helped open up everything. So the pubic bones widen, the hips move apart, and the sacrum moves back. So creating more and more space to birth baby. So like I talked in the last lecture, sometimes the excuse was given that women can't give birth because their pelvis isn't large enough. You know, they're a small-boned woman, so how can she give birth to her baby? But this kind of movements are what allows her to be able to do this. So yes, squatting, leaning forward, and the positions that she's going to be in should be enhancing the blood circulation to the womb, and they should improve the effectiveness of the contractions. So they should strengthen those contractions so that those contractions are actually doing some good. So upright positions, kneeling forward, so whether she's like on her knees and holding onto like the bed or something, or all four positions, all of them are helping reduce pressure on the larger blood vessels. So with each contraction that she has of the uterus is tilting forward. So the forward bending positions are going to help the uterus work against resistance. And of course, we also have gravity. So gravity is going to improve the efficiency of the contractions, and it's also going to allow baby's head to be pressed downwards onto the cervix. So that's going to help with the dilation process, so it's going to speed it up. And then also the standing forward tilting poses are going to help move baby into the correct position. So a lot of the yoga poses will improve baby's position. So here we can see optimal fetal positioning. So the position that the baby is in is going to make a big difference in labour progression and also the time of the birth. So ideally we want baby's head down, so we don't want to have a breech position. So breech position is where baby's head is up and baby's bottom is down. So many doctors and midwives will not deliver a breech baby these days. Of course, some will, and some have the skills, but unfortunately what happens in many institutions, educational institutions, is that doctors are not taught these skills anymore. So it's not their fault, it's just that they don't know how to deliver a baby. They know easily how to perform a cesarean. They're very good at that, but they don't know about delivering breech or some of the other positions that they can be in. So ideally we don't want to have a breech baby. Head down, so the chin is tucked in and the body is turned so the spine is towards your belly button. So this is the anterior position, so you can see that on the left, and the right is a posterior. So here you can see baby's spine towards mama's spine, which can be very uncomfortable for the back especially. So ideally is that anterior. So yoga is going to help baby move into that good position through the different movements that she's going to be doing, the opening up of the pelvis, and also to take that pressure off the back. So things like the squatting positions are going to be helpful, the cat pose, leaning on the wall, so she might be standing and leaning with her hands or her forearms, or leaning on the bed, and doing different types of hip movements and so on are going to be really helpful. So now looking at the different kinds of positions that she can use in labour and birth, now it's very individual, and it's really important that she listens to her own body and what her body is telling her, and that's why it's helpful for a woman to practice lots of different positions when she's in pregnancy, so that she has an idea of what may be helpful, and then during the time of labour she experiments and sees what feels comfortable for her, and it can change. She might like a certain pose early on in labour and then she moves to another position. That's absolutely fine. So she really does need to experiment and see what feels right at that moment. So here you can see also tuning in with one's natural instincts, and sometimes she might end up in a position that she never thought she'd be in. She didn't even know that position. She'd never done that position before, but that's just what her body wanted to get into, and that's absolutely fine. Whatever she feels most comfortable in, and especially if she's feeling progression in her labor or she's able to deal with the pain more easily, then she should go with it. So standing squats can be helpful. So this is where there's lots of different variations of squats. So it might be that she's standing and she has her back against the wall and she's squatting down. So she can squat all the way down towards the floor, or she may just squat a little far down. She might squat holding onto the bed. And it doesn't have to be a full squat, it can just be a partial squat. So even you can see this little picture here where the woman is using a partner as a support. So she's just bending her knees a little bit with her feet apart. It's not a full squat, but it's still beneficial. And she might stay like that. She might sway a little bit, rotate a little bit, whatever feels comfortable for her. Then we have like standing and bending forward onto the bed. So this, is pretty self-explanatory. She might use the wall. So she might want to have her hands on the wall. She might want to have her forearms on the wall. How far away she is from the wall can also vary depending how much stretch she wants to get into the back. Okay, so she can experiment with that, or she might hold on to somebody else as she's bending forward. So whatever works for her. Then we have the right angle pose. So again, this is using the wall as a support. The feet are a little further away, so she's pressing her hands onto the wall and lengthening her spine. So this can be helpful, especially if the baby's posterior and the pain is building in the lower back. So this will help to relieve that pressure onto the spine, and it can also help get baby into the right position. And also forearms on the wall, so that gives a little bit of relief to the back, especially this position. Then she might want to be in a kneeling position. So she might want to go on the floor, she might want to be on a mat, she might want to be on the bed. And these days there's lots of options there with the bed. Often the bed can be moved up a little bit, elevated, so she can have her upper body on the bed head and her knees are on a soft mattress. So she can be in this position, and this is actually really, really common for her to want to be in a kind of kneeling position. She might want to kneel and be leaning against the wall. She might want to lean on a birth partner, and she might want to kneel and be leaning onto, say, a birth ball. And we'll talk about that more later. So kneeling is really, really common as well. And kneeling with her knees a little far apart can also be more comfortable. Obviously, she doesn't want to have her knees together. She wants to be creating space in the pelvis all the time. And the other thing that's important is that for all these kind of positions, she wants to imagine and visualize that her pelvis is opening. So opening from side to side and front to back. So everything is opening and expanding. Now we've talked already a little bit about squatting from standing, so she can squat on the floor. She might squat just simply on the floor if she's used to that and she feels comfortable to be doing that. She might want to use a bolster or a cushion or a block. Like you can see this picture, the lady is sitting on a block, and especially if she's going to be holding it for a while. Because she might be in it for half an hour, 2 hours, so she should be comfortable. So she can be using a wall, so she might want to squat against the wall because a wall is also a nice support for her spine. Or she might be on a birthing stool. So a birthing stool has like a space for if she's going to be giving birth in that position. It's got like a hole, so baby can come out. So she might be on that. Or she might be in a squatting position, but she's holding on to something else. Like maybe there's a rope that she can hold on to, or there's some bars, whether it's on the side, on the wall, or maybe she's in the water, in the bath, and she's holding on to some handles on the wall. So whatever is around that she can hold on to can definitely make it easier to be squatting. Then there's like different kinds of variations that she can be doing, things like a kind of half squatting position, different types of lunge positions, all of these which she might kind of make up at the time that feels comfortable for her. Then we have like pelvic rotations and rocking. So she can be doing that pretty much in any position that she feels she wants to be doing it in, but most common are in standing position and also in the cat pose. So that can be especially helpful for relieving the pain. And also walking is very helpful to progress labor. So especially if she's still in quite early labor, walking and especially going up steps. Many doctors and midwives will recommend to do a lot of walking and a lot of steps to really get labor started up. The butterfly is another one, of course, is opening up the pelvis. We can do the movements of the butterfly. Even if she's in bed and she's not able to get off the bed, she can be doing the butterfly pose. And we've also got side shavasana. So side shavasana, especially with a bolster or a pillow, because that will just keep the pelvis more open. And of course, if she's right in the middle of, intense labor, she's not going to be able to lay down and do a side shavasana unless she's just taken a whole load of painkillers. But she can do side shavasana, especially in the early stages of labor when, okay, the pain is increasing, but it's still bearable. She doesn't feel that she needs to be moving around and she just wants to rest. So a side shavasana can be helpful there. And she can also do some visualization in that. She can do some meditation. She can do some breathing while she's in her side shavasana. So looking at some more positions, so we've got the cat pose, Madrasana. Now I've mentioned the cat pose already. It's a great position for if baby is posterior and there's a lot of back pain because as soon as she gets on her hands and knees, that pressure is going to be released. And many women also find that they give birth in a cat pose. It's pretty common. And very, very natural for women to do. Many women who have never done yoga before, they move into cat pose. It's not that she has to do that movement, the regular traditional movement of the cat. She might just stay on her hands and knees. She might sway a little to the side or do, a few rotations, whatever feels comfortable for her to be doing. And then we have the semi-reclined position, kind of like a squat. So this can be helpful at the time of delivery. So for second stage, and semi-reclined is very different to laying flat on your back, and generally one can move the bed in this manner. Anantasana, Lord Vishnu pose, this is type 4, so this is also a helpful one. Now here you can see the back is flat, but definitely it can be done in a more reclined position. So this can be helpful at the time of birth. And you can also see that other picture of a woman who is squatting. So she has lifted up her heels from the ground. So in squatting position, she doesn't have to have her heels on the ground, whatever feels comfortable for her, but she should feel well supported. So here's a few more. So we've got like a half kneeling position. So this is where one knee is on the ground and the other foot is on the ground. So this is kind of like a half cobra position, but kind of like a warrior, kind of like a half squat. It can be kind of all those things really, depending exactly how she's doing it. But that's also pretty common, and especially a little bit of movement in that position is very common. Then we've got Shashangasana, hare pose or child's pose. So this is a really, really helpful position. So you can see the position in the middle. So here now she's kind of kneeling. She's doesn't have her bottom on the ground here or on her heels. So she might be like that. She might have her bottom down, whatever feels comfortable for her. So especially using the ball, it can really give a lot of relaxation. The ball can be used for many different things. And the birth ball is the same as a yoga ball or a Swiss ball or a gym ball, whatever you like to call them. And many hospitals and birthing centers have one in each birthing room because they know the benefits and how it can help a woman so much. So especially that position in the middle is one that many, many women use. So especially if they've just had a contraction and they just want to relax, and they can relax really, really quickly by just putting their chest and their head on the ball and taking a few deep breaths. And yes, it can be a very blissful state to be laying down over that ball in that way. Of course, we can lay on other things too, like you can see she's on the right side, she's laying on the bed head. The other position you can see is where her hands are on the ground and her bottom is up and her head is down. So this is often known as the slow down position. It's also quite similar to what we think of in yoga as puppy pose, or some people call it lizard pose. So this slow down position is very helpful when the labor is coming on really fast and it's really, really intense. So it will help to deal with the pain a little bit more, and like the name suggests, it can slow it down a little bit. Now, I already talked about it in our previous lecture here that sometimes one does want to slow down the process because it is becoming too intense. She might feel that she's not able to cope with the sensations that are going on. She might feel that it's too much and she's not ready yet to give birth to her baby. So lots of different things can be coming up. And also because her body needs to be well prepared, in that her pelvic floor, her perineum has to be ready, so that she's not going to have any kind of tearing at the time of her birth. So here we can see, more positions. We've already talked on some of these. So using the ball, so having the knees on the ground and just kind of hugging the ball can be really, really lovely. She might want to move around, holding the ball. So it's like some pelvic rotations, or just laying there and swaying a little from side to side, whatever feels comfortable with her using the ball. She might want to be sitting on the ball. So instead of standing and doing like the pelvic rotations and rocking and swaying, she may do all of that sitting on the ball. And yes, we've already mentioned about the slow down position. So that is the helpful one to stop, or not stop, but to kind of slow the process down just a little bit. So now let's look at pain and management of pain, because this is usually the part that most women are scared about. And this is the bit that they want the most help with, of course. So endorphins are secreted by the brain during labor, and they are natural relaxants and painkillers, and they can help one move into a more trance-like state. And I've known many women who have gone into kind of like a trance when they're in labor. They forget about what else is happening around them, and they just focus on what they're doing and focus on the energy that is flowing through them. So many women, when they get into that state, they might be feeling the pain, but they can deal with that. So it is really amazing, that the body naturally produces these natural painkillers. And of course, the more relaxed she is, the more endorphins are going to be released. So it is really important that the environment around her is going to be peaceful and supportive and relaxing. And there's lots of ways that we can have a more peaceful environment. And that's also why it's important that she does kind of put together a birth plan of what she's hoping for. She does talk to the people that are going to be there at the time of the birth, because all of that is going to really be impacting her. If she's anxious, there's going to be more adrenaline released. So the muscles are going to tighten instead, because we actually want the muscles to be relaxing. So tightening of muscles, everything becomes tight, she holds on, and the blood pressure increases. And if her blood pressure is going to increase, it can also lead to more interventions. And what happens, usually one intervention happens and there's a whole cascade. There's a lot of things that can be helpful with pain relief. So apart from those natural endorphins, we've got, of course, the different positions, the different yoga poses, or just different poses that can relieve pain. Then there is acupressure, so different kinds of acupressure. Aromatherapy, so different types of essential oils can be used, different massage oils, and even just breathing in the oils that she likes are going to make her feel more relaxed, which in turn will boost those endorphins. Flower essences, and there's different types of flower essences in different countries. We have homeopathy as well. Certain types of remedies can be useful during labor. Massage and music. So some women really enjoy to have massage. Many women think that they're going to want massage, but at the time of the labor, it's another story. It can be also, someone is giving a little bit of massage to her and also using like compresses, whether it's a warm compress or cool compress, whatever she's needing at the time. Music. So if she has certain music that she really likes that makes her feel very happy, then she can be playing that. These days, you even have women putting together like their labor playlists. So one can have that as well, whatever she feels connected with and she thinks is necessary for her at the time. Of course, she might put together a whole list of music that she wants to listen to, but then when the time comes, it might be that it's too externalizing for her and she just wants to go inward. So whatever she feels comfortable with, it might not be like music songs as such, it might be mantras, it might be chanting, it might be just some kind of relaxing music, like something like the ocean, sounds of the ocean or the forest or the birds, something like that. And then of course water. So I've already mentioned about compresses that can be helpful. Even compresses to the perineum especially can be really helpful to allow the perineum to relax more. It might be that she wants to go in the shower. So having that warm water on her body can make her feel a lot more relaxed. And of course it can also cleanse the energy when you have a shower. And mentioning about water, so many hospitals and birthing centres do have access to water, to having showers, to having baths. Many of them are having them these days because they understand the benefits for the woman in labour. So yes, we've got the shower, but we've also got the bath. So many women do want to be in a bath. And even if she's having a home birth, many women will have a bathing pool or a birth pool. So being in the water can be really helpful because the water, of course, is soothing the body, it's relaxing the body, but it's also supporting the body. So certain positions that she might have found not very comfortable outside of the water, she can be in for a longer period of time when she's in the water. So water is really helpful for management of pain. And then, of course, we have different types of visualizations that she can be doing, which can help her to overcome those different sensations. And breathing. So breathing techniques, we'll go through all these different types of breathing techniques, but breathing is definitely one of the most important techniques for dealing with pain. And I'll just tell you another one which I found very successful, which is kind of like a visualization, but also involving breath and also involving mantra. So with my second child, I visualized the waves. So, if you just draw the ocean waves on a piece of paper, so you've just got a line coming from the side and it comes up to a peak as it's curving and then it comes down and then around again. So you've got the waves. So just from just a 2D version. So when I was going through the contractions, I was visualizing the wave. So as the contraction was getting stronger, I was visualizing the wave getting to that peak because I knew that, okay, the contraction is going to get very strong, but then it's going to go and I'm going to feel great. So I would visualize that contraction getting up to its peak, and at the same time I would chant Om mentally. So I'd be chanting Om and it would be going for a really long time till it got to that peak, and I'd finish the Om and then it would move down. So if you can imagine, the wave, that point of the wave, and then it comes down and then it slowly starts to build up again to another contraction. So having something to focus on visually, I found is really helpful, but also having mantra, because Om is very calming, and also when you're doing it to the breath, it's even more soothing. So it's good to have visualizations. Of course, there's all sorts of things you can visualize. You can be visualizing, the pelvis opening up. You can visualize energy moving downward. There's so many things that you can visualize. But the breathing is going to be really, really helpful. And next I want to look at the connection, mental connection. So as I said at the beginning, we have to pretty much let go. We need to surrender, and we need to allow the energy that is within us to guide us. So the practice of yoga helps us to learn how to listen to our body and our mind and our inner guide. So meditation and mindfulness is going to build that awareness, but many of the yoga practices are going to be doing that. And at the time of labor, we really do need to look inward instead of outwards, because we know what our body needs. We have to experiment, yes, but we move into different positions, we do different breathing, we have our mind focused, and when we're really listening and in tune with the energy of nature, the energy of birthing, then we can do it. So here you see this next point. Your body knows what it's doing and what it needs. Think of animals giving birth. They don't need training. They just know what to do, and women, we know what to do, but often we've forgotten that, or we don't have faith in that, or we don't trust our inner guide. So it's really important that we listen to that. And if we're feeling a lot of fear, then it's going to create more tightening of our muscles. It's going to make our breath much more shallow. So pranayama is going to help relax our muscles, but also deepen our breath and also soothe our nervous system. So we can be checking in with our body all the time, scanning our body like you would do in a shavasana, but you can do it in any kind of position, scanning the body, checking how your body's feeling, and using the breath to relax. So there's a few points to remember before the birth and to be reminded of during the birth. And these are points that I ask women to put up on their wall, next to their bed, to read them every day, to put them all around the house. And I like to have them up with pictures of women, like I was showing you, the traditional ways of birthing. It can be really nice for women to see that so that they feel really positive about giving birth and they really trust and believe in it. So these are just some points, and you can put these points into yoga nidras as well. But these points I've given to many, many women, and it's helped them a lot. And at the time of labor also, they've remembered these points, or their birth partner may have read the points out to them as well as a reminder. So here are some. So my body is perfectly designed to give birth. It has the knowledge, wisdom, and power. Okay, we should believe in our bodies because they are designed especially for this purpose. I have trust and faith in my body's ability and my baby's ability. Women have been doing this for millennia. I have faith in the universe and the divine female energy. Birth is a miracle. I'm lucky to be able to have this experience. Each contraction is an expansion, and it brings me closer to seeing my baby. This is one that I always like to remind women of. So when they're starting to get upset that that contraction was a little bit too strong, well, it helped. It helped her to see her baby sooner. All pain is not really pain, but tension. And this is also a really important point that we need to think about. The pain that one is having during labor is not from an injury. So there shouldn't be any fear about it. It's not like we just cut someone's arm off. That tension is there, or that pain or discomfort or sensation, whatever you like to call it, it's there for a reason. It's there to help. It's there to help baby. And it's there for the woman to give birth. So it's really important that she understands the difference between that. So observing and embracing it as a witness, so taking a step back. It's a transformative experience. Notice the sensations, what feels better, rhythms, patterns, the effect of the breath. The pain is not working against me, but with me. Something to remember. Okay, letting go, surrendering, and go with the flow. Release any tension that may be there mentally or physically. Remember, I am opening up. Okay, so you can visualize a flower that is opening. Welcoming the process, accepting and surrendering, relaxing and trusting, okay. Grounding and centering, so connecting with the earth, trying not to control but instead become one with the energy of birthing. Like I said, birth is unpredictable. We can't control what's going to happen. We can't control that, okay, my first stage of labor is going to go for this long, and the second stage is going to go for this long, and then I'm going to give birth this way. You can't do that. And when we try to do that, that's where the problems come. And the last point here, avoiding negative birth stories, instead reading positive ones. This is really important because, as I've mentioned in previous lectures, women hear the negative birth stories a lot. They don't hear the positive ones so much. And these days, most women have not been present at another woman's birth. It's not as common. And of course, because a lot of women, most women these days give birth in hospitals. So previously, they would give birth at home. They may have family members, they may have friends around, other women who are all supporting her. So these days, most women have never seen another woman give birth before they actually give birth themselves. So because of that, there can be a lot of fear, seeing things on the TV, of course, as well. It's not often that in the films you see an amazing transformative birth. Usually she's, screaming and panting. So it's important that she starts to read about positive birth stories. And there's a lot of books now about positive birth, and there's a whole big organization called the Positive Birth Organization too, which is all over the world, which is trying to promote positive births. So by hearing about positive births, she gets an idea that, oh, okay, it doesn't have to be all screaming and pain. There can be some good parts to it too. So it's really important to have those. And it's important for her to say that if someone does want to give their birth story and it's really negative, it's her choice. She doesn't have to listen to it, because it is funny that women do like to tell their negative birth stories. Even when, a woman is pregnant and it's starting to scare her, still women say these things. So it's important that she decides what she wants to listen to, just like she decides what she wants to be, watching on the television or on, other media. It's her choice. So now looking at breathing. So as per yoga, there's no particular way that she needs to be breathing during labor. Now, there have been many different kinds of techniques in the past that have been taught for women to do, but what is most important is that she has deep, relaxed breathing. So she's relaxing as much as she can, and she's focusing on her breath. And by focusing on her breath, her body is relaxing and her mind is also relaxing. So being conscious of how much energy is in her breath and the power of her breath. So for example, when she's inhaling, she's giving prana to her body, she's balancing her body, she's getting more oxygen. And when she exhales, she's breathing out, tension, stress, anxiety. So she can be visualizing that. She can be also visualizing the connection between her and baby. Then being a witness will keep her focused and centered. Focusing on breathing downwards can also help in the birthing process, as well as focusing on the belly, the womb, the baby. Putting hands on her belly is also very helpful. And breathing is one of the most helpful techniques because she might have learned many things, but then at the time of labor, she can forget a lot. And that's why it's really helpful to have a birth partner, to have a doula, so to have people around that can remind her of the things that she wanted to be doing that could be helpful. Because it's very hard, as I said, to remember these things, but breathing comes naturally. So she might forget everything else, but she doesn't forget the breath. So looking at other kinds of breathing practices that can be done. So ujjayi breath can be helpful if she's feeling very tense. It can help if she's feeling very anxious, and it can be used when she's having a contraction or in between. Bhramari, the hummingbee breath, is also very helpful. Again, it's good to stimulate those natural endorphins, so to help deal with pain. It also helps build connection to one's inner strength, inner self, and it's very healing as well. The cooling breath, so Shitali and Sitkari, is going to be helpful to keep her focused, but it also has a really nice relaxing effect on the nervous system. Then deep breathing, so here I've written with a visualization of a flower opening at the cervix, but there can be other kinds of visualizations done as well. Pretty much visualizing opening. Then we've got like the cleansing breath, or can be known as feather breathing or golden thread breathing. So that's the one where we're inhaling through our nose and exhaling really slowly through the mouth. So this can help to relieve tension. It also, like I write here, keeping the jaw relaxed is going to keep the perineum more relaxed. So as we've mentioning in prenatal yoga all the time, you want to be relaxing the jaw. So especially during labor, it's really important. So that kind of breathing can be helpful. It can be really helpful when contraction is very strong as well, that she's just very slowly and in a controlled manner, she exhales out. Then we've got things like birth breathing, which is a technique from hypnobirthing. So taking in an inhalation and then slowly exhaling, and kind of like the shape of a J. So coming down and then out. So that's the birth breathing. Fast breathing can be used sometimes during the contractions if they're very, very strong. Some women will naturally want to breathe fast. It is important that she's not doing fast breathing all the time, because she can feel very dizzy, she can feel uncomfortable, kind of woozy and lightheaded. So just if it's a little too strong, that can be a technique that she might want to be using. Many times if a woman is doing fast breathing, she's kind of doing it through her mouth instead of through her nose. So that's something to consider, that she can also get quite dehydrated. And then we've got breathing with baby. So like I was saying, connecting with baby. So, inhaling, sending love down to baby, and exhaling, feeling everything relax. Now, moving on to chanting or sounds. So women give birth in different ways. Some women fall into a complete trance and they don't say anything. They're completely silent. And that's fine, absolutely fine. Other women, they want to make sounds. And sometimes by making those sounds, the jaw relaxes. So that can kind of be one of the natural ways of, releasing tension in the jaw. And as I've said, that tension in the jaw is related to tension in the perineum. So some women will definitely be making sounds. It's very individual, so if a woman is really just listening to those energies, getting in touch with those energies, then the sounds that come can be very strange, can sound like different types of animals, like a cow or other things. But it's really important that she just allows it to happen. She doesn't try to control it or hold back, because it's her birth. It doesn't matter what people think. It's her birth. So she should do what feels right for her and comfortable for her. So whether it's a a full sound or a part of a sound. She might want to chant Om. She might want to do part of Om, like Ah or U or Ma. That's all fine. And generally those sounds are going to become a little bit more intense as the contractions are building up. And of course, when contractions are at their peak, it can be hard to make full sounds. Of course, one can't be speaking a sentence when she's having a full-on contraction. So she might just be making a little bit of a grunting sound or just a slight sound. It's very, very normal, very, very natural. So, or she might be completely silent, and that's how she deals with the contraction. So it is important that she doesn't just spend her time shouting. The sounds should be helping her. They shouldn't be working against her. So that's where, it's not recommended to just be, shouting at the partner or something like that. She should really be focusing her energy downwards and making sounds that come instinctively. And here the last point, remember that if you do chant, keep the mouth and jaw relaxed as it helps open the cervix. Oh, and the other point, she might decide that instead of actually making sounds herself, she wants to listen to them. So like we were talking about music earlier, she may be listening to chanting of Om or other types of mantras, whatever suits her at that moment. Now looking at other suggestions. So connecting with baby by having hands on the belly is important, and especially because it reminds the mother that she's going to be meeting her baby soon, and it also reminds her that they're doing it together. Baby also has to go through birth, so it's important to feel that connection. Then avoiding externalization, so not too much talking, not too much disturbances. So that's where the environment is really important. And you'll see, animals, when they want to give birth, they usually go to a place that's quiet, that's not as light, so that they can just focus inwards and go through the process. So if she's in a room and there's lots of people talking, that can be very, very distracting for her while she's going through the process. So it is important that she only has certain people that are really going to be supportive, and we'll talk about that more soon. So also thinking about the environment, like having it a little bit quiet, yes, but also not so bright. Now, many birthing centers and many hospitals also can dim lights, so they can make it a little bit more relaxing, a little bit more calm. Of course, you can't have things like candles in hospitals these days because of the hazards, but we can have other things that make one feel a little bit more relaxed. So as I've mentioned, it might be some gentle music, it might be essential oils. So we can burn essential oils in an electric oil burner, or we can have some essential oils in a spritzer to spritz the face or put on a tissue. We can have photos that are going to make her feel more relaxed, like it might be a photo of an ultrasound, or it might be, a photo of a powerful woman, or, someone that she admires. So those kind of things can be there to give support and to make her feel more comfortable and to make her feel safe. The bright lights and a load of people in the room does not make anybody feel very comfortable. And that's again why so many women are starting to choose to birth at home instead, because they feel safe. So here I've just put a few types of essential oils. It is important that if you are going to have essential oils, use essential oils, you know what they do, because some essential oils are not recommended for pregnancy, and that is because they can increase contractions of the uterus. So it is essential that she has proper guidance to use essential oils. But some oils can be useful, like they might not be useful during pregnancy, but they're useful at the time of birth. So things like clary sage and jasmine can be used during that time, and used as in one might have them in a massage oil, one might be just smelling them, they might be burnt in an essential oil burner. Geranium, rose, these can be nice oils to use, and of course any oils that she just really loves that make her feel calm and relaxed, she can be using in her oil burner. What she's using on her skin, again, it's really important that she understands how much dilution needs to be done. Then sending loving thoughts to baby. So like I was saying about putting hands on the belly, so also sending those thoughts, or even talking to baby, saying we can get through this, I'll meet you soon, sending lots of love. And then using any affirmations that feel right. And especially, the ones that she was using throughout her pregnancy are generally the ones that she's going to be thinking about at the time of the birth. And her sankalpa. So her sankalpa that she's made, she can keep remembering that. It's going to be really, really helpful for her. And especially if she's going through some difficult times during the labor or the birth, remembering that sankalpa is going to just bring more faith and trust into her body. And then birthing meditation. So birthing meditation can be practiced at any time when she feels comfortable, especially at the early stage of labor. Birthing meditation is useful. Later it can be hard for her to focus for very long, but she may be able to do it depending on the position she's in. And now looking at this next point is the 3 R's. So these are actually the most helpful characteristics in women who have been able to cope well with childbirth. So relaxation, of course, then rhythm. So she has to find her own rhythm, whether it's the rhythm of her breath or the rhythm of her movement. And of course, the rhythm may change during that time of labor. And then ritual. So whatever she feels is necessary for her at that moment, she can follow that. It might be that she just needs somebody to rub her lower back. It might be that she just wants to be under the shower. So whatever she feels she needs at that moment, she should do. So here you see that last sentence of each woman will find her own individual way. So understanding that she has that energy that is there through her, she just has to tap into it. And here comes our slide on support. So we've already talked about support quite a bit. So having a birth plan is definitely going to be helpful. Her birth plan can include who's going to be there in the room, how the environment is going to be, what her choices are, what she's hoping for, remembering that a birth plan is just a plan. It doesn't mean that it's going to go exactly that way, but it can be very helpful. And especially, if she's in the hospital and she has a midwife or she has a doctor there and then they change shifts. The doctor or midwife doesn't know her. And by looking at her birth plan quickly, they can understand, okay, so she wants to try to have, a natural birth as much as possible. She doesn't want to have, pain medications. She wants to try different positions. So they can see all this straight away and they can get a little bit of an understanding. So as I've said, a birth plan is not set in stone. We have to have flexibility, but it is an outline of what one can hope to have. And even things like can be in there, like having the delayed clamp, cutting of the cord. It can be that the vernix is not rubbed off the baby. There's all sorts of things can be discussed in a birth plan. And it can be helpful to talk to her midwife or doctor if she knows she's going to have a particular one that's going to be there throughout the whole birth, which will help her a little bit more. And also it will help her birth partner who's going to be there, and if there's going to be a doula. So, in different countries, there's different options of what is allowed, who's allowed to be there in the hospital or the birthing center. So generally, the partner is going to be there, not always. Sometimes she might feel more comfortable with somebody else, whether it's a mother or a close friend or someone who has gone through many births. So whoever is going to be that partner, they have to be supportive, they have to understand what she wants, and they need to be able to remind her of that sometimes. A doula is another person who is now becoming more and more common in birth these days, because the doula is there to look after the mother. So, a midwife or a doctor is there to help with the labor and delivery, but the doula is there only to take care of the pregnant woman. So the doula might be there to talk to, she might get things for the woman, whether she needs a drink, whether she needs some massage, whether she needs like a compress, whatever she needs at that time. It may be that she gives some prompts. She might remind her, oh, remember this breathing technique that you've done, or remember this yoga position, or why don't we try the birth ball, why don't we do this? So she is there to look after mother only. She's not there for baby. She doesn't have the skills for delivering babies, but she is there just for the mum. And this is something that can be really helpful, because sometimes the partner or the people who are there as supports don't have enough knowledge or understanding, and they don't know what to do. So a doula is trained in caring for the mother. And then, of course, I've talked already on the environment. So having a safe, comfortable environment as much as possible. So avoiding having lots of people in the room. And this is where the doula or the partner may say, look, can you please avoid talking too much? Can you please try and stay out of the room? Because, especially in hospitals, people can come and go all the time. And she can feel very uncomfortable. She can feel very self-conscious if there's lots of people around. So it's really important to protect that environment, to trust in your network, and change if the trust isn't there. If you don't fully have trust, in what the doctor is saying or the midwife is saying during the pregnancy, if they're giving you different opinions that you're not sure you agree about, or they're not ready to listen to what you're hoping for in your birth, then it might be that you need to talk to somebody else, because there's a big range of opinions in how birth should be. And with doctors, some doctors are very, very good with natural ways, some doctors have absolutely no idea. So there's lots of different trainings and experiences that can be there for doctors and for midwives. I remember when I was giving birth to my second child, there were some doctors that wanted to come in. Now, I didn't have a doctor, I had a midwife, and the doctors wanted to come in, some fairly new doctors, because I was in the water, and they wanted to see a baby being delivered in the water because they hadn't seen one. And I thought, wow, that's kind of crazy that they haven't actually seen a baby being delivered in water, because it's so common these days. But no, not everyone has seen the different ways of giving birth. So yeah, you need to make sure that you feel comfortable with whatever kind of person you're going to be having there at your birth. And if not, change. Remembering it is your birth and no one else's. Okay, so not feeling pressured to act in a particular way or conform to what others perceive is the correct way. And when I say this, many people say, oh, but the doctor says this, the doctor says that. Now, as I said, there's lots of different opinions, there's lots of different ways of doing things, and the world is changing a lot. In every country, the way that women are giving birth is changing. So it is up to women to start standing up for themselves, because previously often women have been treated very badly at the time of labour and birth. Many women have been shouted at, abused, things done to their body that should not have been done to their body, and they have been left traumatized. So this is where a lot of women now are standing up all over the world and saying that it's their body, it's their right, and it's their birth. So it's important that women feel empowered about this, because it's such an important event in their life. And women who have been traumatized by the birth, they can take that with them for life. They can feel that for life, and it can create so many more problems later down the line. So it's really, really important that her birth is supported and positive. So yes, following your instincts, doing what your body needs, my birth, my body, okay? And interventions, we've mentioned these earlier. So if she's having a lot of interventions, if she's having, say, a lot of monitoring, that can decrease contractions. Examinations can increase stress. They can also decrease contractions. So she can also say when she doesn't want something to be happening to her. And this is where the more education she has about labour and about the different options of what she can be doing in labour and the birth, the more power she has within her. So this is about yoga for labour and for birth. And we'll move on to the trust your body, acknowledge your innate wisdom, and follow your intuition. So this is really important for her to remember. Hari Om.